Chronic low back pain is one of the leading causes of disability in the U.S., affecting millions, including thousands here in St. Louis. And now there's a solution helping patients retrain their muscles, restore spinal stability, and break free from that chronic pain. So joining us live is Dr. Vinny Francio. Dr. Francio, thanks so much for being here today.
Thank you, my pleasure.
Okay, so why don't we first just talk about this? It's called Reactivate, and it's really changing lives in a whole new way.
Absolutely. This is called Reactivate Restorative Neurostimulation.
Okay.
It's a treatment that we have now available for patients with chronic low back pain that have tried the conservative methods such as physical therapy, medications, injections, and then are not candidates for a spinal fusion or a surgery. This is a therapy, a procedure that we have started here in St. Louis last month for a new era of the treatment of chronic low back pain.
Wow, so this is, really exciting for a lot of people because there's so many, as we mentioned, that suffer from this lower back pain. So can we talk about how it targets the root cause? Why it's working, really?
Absolutely. So this device, exactly like you mentioned, treats the root cause of the problem, which treats the muscle called multifidus muscle. That is a muscle that stabilizes your spine when you are doing basic day-to-day activities. Simple things like getting in and out of the chair, in and out of the car, doing the dishes, stuff like that. This treatment basically will stimulate the muscles of the lumbar spine and will create strength of those muscles back to the normal physiological function, the normal function, and improve the stability and therefore reduce the pain.
Wow, so it's I like that it's going straight to the root cause. That's really what you're saying here is we're going to fix why you're even feeling this pain. So who can be a candidate for something like this?
Patients that are a candidate for this procedure have chronic back pain for 6 months or more.
Okay.
They have tried the traditional treatment such as medications, physical therapy, even some injections. Perhaps they have seen a surgeon and they are not a surgical candidate for a fusion or a decompression. And those are the patients that were told, unfortunately, hey, we don't have anything else to offer you.
Yeah.
This is that therapy that is really groundbreaking that now we have something to offer them.
Okay.
Patients that have chronic back pain for 6 months with daily activities. And like you mentioned, these are the patients that are really looking for to treat the cause of the problem and not just symptom management with pain control.
Right. And what does the recovery look like for something like this?
The recovery is very simple. This is an outpatient procedure. It's done in a day. The patient will go home the same day. We follow up with the patient in our clinic in about 1 week after when we activate the device, 1 or 2 weeks. And then we'll follow up again in a couple weeks to make sure that the device is working properly and the patient is starting to feel those muscle contractions that will, over time, improve the strength of the lower back spine.
Wow. It's really incredible. And so I know if people, of course, if they want to learn more or if they want to give you a call, is there anything that they could do to know? We have our website here on the screen here, but I just want to make sure that this is open if people are interested.
Absolutely. This is a treatment that is available here in St. Louis now at Washington University Pain Center. We were the first ones to bring this technology to our metro area. So patients can call our clinic or they can visit the website, lowbackrecovery.com, where they will be able to read more information about this procedure, and we'll be happy to see them in the clinic if they have an interest.
Okay, perfect. Thank you so much, doctor, for joining us today.
Thank you.
Again, you can learn more, ksdk.com/showme to schedule that consultation.